Thanks everyone for coming today. If anyone wants to know questions, raise the stage on the left side of the podium. If you don't want to take questions, you can stay here. Follow along with me if you want to be available.
Left side?
Yeah. Yeah, so I'll introduce you. Yeah. Yeah. Why don't we stand on the other side? Okay. Chief, come on over. Yeah. Stand right on the side of the other.
All right, welcome everyone. Thank you so much for taking time to be here today. We just had a great opportunity to meet with some of our state leadership around what is happening with COVID-19 and especially how it is impacting the city of Manchester and some of our local preparedness efforts. We did activate our Emergency Operations Center in the city over the past week, and we've been meeting with all of our partners who have been amazing about how do we coordinate our response. I also want to recognize the New Hampshire Department of Health and Human Services, who has been a really integral part of all of these planning efforts, and they've been amazingly supportive. So without further ado, I'd like to turn it over to Mayor Craig to offer some opening remarks.
Thank you and good morning. I want to thank all of you for being here today and thank Congressman Pappas for bringing us together to discuss how COVID-19 is being addressed at the federal level and to learn more about Manchester's readiness to address a potential outbreak. While there have been no known cases of confirmed illness among Manchester residents, as Anna just mentioned, we activated our Emergency Operations Center to support ongoing planning, communication, and coordination of prevention efforts. The plans and infrastructure created for 9/11 to respond to large-scale infectious disease outbreaks are serving as a foundation of our local prevention efforts to respond to COVID-19 if warranted. We're also asking every city department to complete a continuity of operations plan to ensure continuity of their essential functions in the event there's an incident or emergency that disrupts normal operations. This includes such things as identifying essential workers, cross-training employees, and identifying alternative ways of doing business. The public relies on us, and it's our responsibility to provide uninterrupted services to the best of our ability, regardless of circumstances. As a reminder to the public, please take common sense steps to prevent COVID-19, as well as influenza and other respiratory illnesses by implementing healthy practices such as washing your hands for at least 20 seconds, avoiding close contact with people who are sick, covering your nose and mouth when sneezing or coughing, and staying home if you feel ill. By being prepared, following federal travel advisories, and keeping healthy practices, we can work to prevent the spread of COVID-19 in our community. Thank you very much, and it's my pleasure now to introduce Congressman Chris Pappas.
Well, thank you very much to the mayor and city officials who are here, to Director Thomas and Chief Goonan. Thank you very much for your efforts and for providing us with some really good information about the local response here in Manchester. We also in the briefing had representatives of the Manchester School District, Dartmouth Hitchcock and Elliott Health Systems, Catholic Medical Center, Amoskeag Health, as well as our first responders, our EMTs, firefighters and police officers, and a representative of the airport. The briefing we completed gave us confidence that city and local leaders are working very closely with our state health officials, and I really want to commend the folks at the State Department of Health and Human Services for all their efforts to date. They have been working round the clock. As we know, we've seen 2 positive test results in New Hampshire, as well as 2 presumptive positive test results over the weekend. And we need to continue to ensure that the response efforts all across New Hampshire remain strong. That's why we passed a comprehensive package last week with a large bipartisan vote in both the House and Senate, signed into law by President Trump, to make sure that states like New Hampshire can continue to do the work in terms of containment and mitigation that's going to be so important to protect public health and ultimately to save lives. Dr. Chan indicated over the weekend that the new detections don't indicate necessarily a wider spread of community transition because they can trace contacts between these individuals to the 2nd and 3rd case. I think as we're looking here in Manchester, we need to continue to listen to our public health officials, including those from the Manchester Health Department, who are telling us to remain calm, to follow good personal hygiene measures, making sure that we're doing all we can. They're hard at work.
Yeah.
Making sure we're doing all we can to protect ourselves and prevent the spread at the community level. Included in the supplemental funding package that we passed through Congress last week is $2.2 billion in public health funding for prevention, and that includes a provision to reimburse state and local response efforts. Also $3 billion for the research and development of vaccines, and we all know that's going to take some time. $1 billion for medical supplies and health preparedness, including funding for health centers. $1.25 billion to secure Americans' health by addressing the coronavirus overseas, and $300 million to ensure that Americans can get vaccines and treatment once they're made available so that these are affordable to them. We're going to continue to work hand in glove at the state, local, and federal levels, making sure that New Hampshire is as strong as it can be in this front. I think we all understand that this continues to be a matter of when and not if we see more cases of coronavirus across this country, including here in New Hampshire. So we want to do all we can to lift up the voices of those in the public health community, make sure that we're taking the steps that are necessary and ensuring that there's a well-coordinated response. So with that, someone who has been doing a great job of leading that local coordination, I want to introduce Fire Chief Dan Newton.
Thank you, and thank you, Congressman Pappas. This was a great opportunity for us to see what's happening at the federal level, to share what's happening at our local and our state level. This is really for us an all hands on deck type of response. Right now we're really just in the planning phase. We're monitoring. We're at enhanced monitoring level. So it's some of the back and forth that we had and what our stakeholders had is presenting what our concerns are as a community and kind of coordinating with the federal government as well as the state. So why don't we open this up to any questions you may have? We have a lot of folks here from our stakeholders and really the professionals that are responding to this issue. So why don't we open it up?
Do we know of any impacts to the Manchester airport at this time in terms of passengers coming through?
We do have the airport director right here. Maybe he can come up.
I didn't hear the question. Can you please? Do we have an impact on passenger counts yet coming through MH2?
Not yet. We're working with our airlines to get some advanced booking information so we can quantify if there are any decreases, but we have not received all that information yet. We're kind of in that interstitial period right now between winter break and spring break, so it's always a little bit of a shorter period at the airport to begin with. It's hard to tell if any impact is associated with coronavirus or if it's just travel habits.
city level, and what sort of would be the next step in terms of what has to happen, what we're seeing in the community to move to a contingency level plan?
So this is something we actually do on a regular basis. Our city health department, for example, is responding to infectious disease 365 days a year. When something like this ratchets up, there's different phases that we go into. The city has large-scale plans, pandemic influenza plans, for example, and we exercise to those plans. So we train all of the time with our staff, with our local healthcare providers. It's something where we're always thinking about what's going to be that next step and what is the what if. We're also very mindful of what's happening statewide. So even though the city of Manchester has had low activity so far to date, we know we're the state's largest city and with a very populated area. We're very mindful of the fact that we're going to have to constantly be ahead of this. So we work very closely with the Department of Health and Human Services about when we would essentially advance the next step of the plan, and each of those scenarios would be very different depending on the cases, the connection those cases have with the public. Is it community transmission? Is it still something very isolated to one individual or one family? So all those factors come into play before we start to really layer up and out to other systems that would be impacted.
What's an appropriate level of concern right now? So many people just don't know how to think or feel about this.
Right.
You see on social media, some people are like,
Yeah.
I'm not worried at all. Some people are really freaking out. So what is an appropriate response for this?
Yeah, so the reality is that we are real time getting information from all over the world, right? And so I think that adds an extra layer of stress because people are seeing what's happening in other countries. Right now, things are quiet in the city of Manchester and relatively speaking in the state of New Hampshire. So the guidance we're giving people is what we would give everyone during any normal cold flu season. So use all those sort of self-protection techniques. We want you to wash your hands, wash your hands. If you have children, help them wash their hands. All of the things about coughing into your arm and staying home if you're sick. All of those things are best practices right now and what we all can do to help contain the environment. And I think at the end of the day, we will learn more as we see this disease progress around the world. And then that epidemiology informs how we respond to it as well, because many diseases take on different patterns and trajectories. So this is a newer one for us to understand and learn. But at this point, the best thing that everybody can do on an individual level is really do those self-precaution, techniques. And we're also seeing some advisories come out for our older populations should probably limit their exposure to community at this point. But other than that, this could change tomorrow based on, again, if we hear about new cases. Right now, we're trying to just take it day by day, but we also are trying to follow the fact that you can never be too, protected. So keep going out there, doing those things that you would normally do during cold flu season. Be really vigilant, and then stay tuned because advisories are coming out literally every single day, and that guidance could change.
One of the questions we get a lot is about school closures. Do you have, is there some kind of threshold at which that would make sense to do in Manchester?
Yeah, and again, I think it's the same kind of response. I think we would take into account all of the nuances. Is that a family? Is it someone who traveled? Are they isolated? Is it something, we look at all of that in the case investigation as far as the exposure and risk that they might be placing to someone else. So if we felt there was community transmission as a risk, we would probably look very closely at what would happen in that district. And that's going to be a case-by-case basis. I know the district has large-scale plans in place that they also would exercise in the event of this or any other emergency.
Community centers and any change in planning for programming for senior citizens, anything like that? Have there been any changes there?
Right, nothing right now, but it's an excellent question because again, I think day by day, this is going to be a changing environment. We are just recommending that people, if they can, not travel, kind of stay close to home if you are a senior citizen. At this point, nothing is changing as far as what we're asking to do in these facilities other than bringing in the best practices, like we said, do all the self-precaution sort of techniques. But this, again, could change depending on the epidemiology of the disease and whether or not we see community transmission.
Not everyone can take 2 weeks off of work to self-quarantine due to lost wages. Is there any thing in place to help people like that, and what would you say to people like that? And they feel like they can't do something.
Right. So we're actually working with our Chamber of Commerce, for example, and the local businesses about this very fact. And we're really trying to encourage workplaces to do what they can to prepare alongside of healthcare delivery systems and public health systems. We all have to take into account that if there is community transmission and it's going to affect the workplace, we're going to have to modify work environments. And it's something that even as a city, we are one of the city's largest employers as a city government. So all of our department heads were briefed last week, and they're all being asked to develop continuity of operation plans where if you had to default back to maybe a skeleton crew, or you had to provide alternatives for employees to work at home, these are all new plans that businesses should take into account and start planning for now if we get to that point. So right now we're still in those early stages that we're not in a mitigation phase where there's large volumes of cases where that might impact workplaces. We're still in a containment phase. So we definitely want to do all that we can just to make sure everybody is healthy in their workplace to prevent sort of a large-scale situation where people would be out of work. But I think we're asking all businesses to really think about their internal operations and how can they best accommodate employees if this scenario were to play out. So all of this is really the what-if scenarios, and in the worst-case scenario, start planning from that point and start to peel backwards, scale backwards as far as having a local business plan.
Do we have a sense for a timeline for commercial tests being available at CMC or other providers in the city?
So we've been told that they're actually being offered this week, that's now becoming available. This is something that's all, again, developing on a day-by-day basis. So there's testing available at the state, but some of these private companies are starting to launch availability of these tests. And you could literally go to each of their websites to see the status of those, and we can give you those contacts afterwards.
Thank you, everyone, for coming. Appreciate it.
We appreciate you being present.